Good morning, everyone. Unfortunately, Dr. Whalen can't be here today. She had a long night. The pod was successful last night. She was feeling a little under the weather, so she will not be here. But today marks 337 days since this began on March 12th. 11 months today. A milestone I never thought we'd be in. A milestone I did not want to be in. Like everyone else, we're tired, but we got to keep staying strong and we got to get through this. And we owe it to everyone to get through it. Light's at the end of the tunnel. We're almost there. Vaccine's getting out. Hopefully we get more vaccine as we go on. We have the demand. We just don't have the supply. But be patient. And the good thing is our numbers are going down. But the sad part is people are still dying, unfortunately, from COVID-19. So there's one new death to report today. A woman in her 80s passed away. To the family, my prayers and condolences go to the family, to all the families. It is a very difficult time to lose anyone in your life, regardless of the situation, but even harder when you can't say goodbye the right way. Though it's gotten better over time to open up a little bit, but it's still tough to send someone off the way you love them. So again, my condolences and love and prayers go to the family. As of today, there's 19,443 cases of COVID-19 in Albany County to date. We have an increase at 85, and I was talking to Dr. Whalen about this, which is good. But again, so it's a big, it's a number, but we are going in the right direction. We're going down. The 5-day average is 84.8. Yesterday it was 88, which is all good news. There's currently 1,805 people under mandatory quarantine. Yesterday it was 1,885. Of the positives, 20 have close contact with positive cases, 5 are healthcare workers, 60 don't have a clear source of infection. As of today, 59,562 people have now completed quarantine, which is good. Out of those, 18,656 were positive and had recovered, which is also good. That's an increase of 144 new recoveries since yesterday. There was 9 new hospitalizations overnight. We have 91 people currently in the hospital, and yesterday that number was 90, so we increased 1. There are 17 patients currently in the ICU. Yesterday there was 16. So please, I know we're getting there. The weather, it was a little chilly yesterday. Supposedly it's going to get nicer as we go on, right? We're almost in mid-February. It's going to be a little bit colder, but please remember to wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We're getting through this, but we need to continue to work together in a partnership to get through this, and we need to continue to keep the message out there to get through this. For those who want to get vaccinated, please check your eligibility. That's the key. I did get my personal Facebook, and I will say this. I apologize to the man that showed up from the U.S. Postal Service to get vaccinated and stood in line with his uniform on, but it wasn't his category. He got on, he got through. We apologize. Dr. Whalen and I, we try to continue to let people know who's eligible. We try to put the information out there. Some people get through, unfortunately, and some people don't tell the truth. I'm not saying this person didn't, but some people don't. They try to get through, and then when we ask for that data, the proof that they ask that, how do you fall in, how are you a teacher, do you got an ID, are you police, are you fire? Because our pod, that's all we can do, unfortunately. It's sad when we got to turn away 80-year-olds because we can't do 65 and above. We have strict guidance from the Department of Health, and we can't vary from that. And I wish I could, because there's nothing sadder when you got to look at somebody and say, yeah, I'm glad you got this appointment, but we can't give you that shot. Or I could get $1 million fine or lose vaccine going into the future, because that's what's pressured on us every week. So I do want to say, it's tough, but we're in this together. United Way, Pete Gannon, United Way, thank you for what they're doing, but the hotline for getting information, please continue to call. They'll help walk you through it online. They'll get you the numbers. They'll help you with the category, where to set up an appointment. So the availability, 24/7, 365. They're there. So thank you to United Way. Also, I want to remind people we've launched our new pre-registration tool to get people signed up so we can make it easier, less frustrating, and stop the Hunger Games where people got to keep going on every week. Because like I said, our pod filled up in a half hour. Who? I don't know about you. I can't click that quick, and get through it. So, imagine somebody who's just trying to go through, or a teacher working, or a firefighter working, or a police officer working, and now they got to take a time to sit there and try to pre-register to get on. So it was a huge success. So in the first 24 hours alone, we had over 8,000 people pre-registered on the site. I mean, it kind of, So out of that, 6,300 were Albany County residents that pre-registered at 8,000. Some were duplicates, so we had to go through and figure it out. But good issues to have, good learning issues to have, to sit there and figure this out. I will say this: if you meet that category, you'll get in. We'll text you whatever way they signed up via. They want to be contacted with text, email, or phone call. That's going to happen, and just be patient. You can sit back now, continue to do the right thing. If you're staying at home, stay home. If you go out, wear a mask, socially distance, do the right stuff, and we'll get to you. So when your category hits, or we get approval to do whatever category you fit into, you'll get in. You won't have to call again. You won't have to keep monitoring. Just look for your right time, and it might take a couple weeks. It might take 2-3 weeks. Might be next week for some of them. But I can tell you that 8,000 people, we only get 800. So I think last night we did 800 vaccines, 400. On top of that were people for their second shot, and another 200 on top of that. It was a huge success. But again, so that's the amount of vaccine we're getting in. So again, you got to be patient, and but we will get to you. So it was a good tool to stop a lot of people's high blood pressure from going up and being nervous about getting in there. So, we know the virus has taken a larger toll on our minority communities as well as our older residents, many with underlying health issues, which opens up this week. We're still waiting on the guidance from the Department of Health. It's kind of changed. I was on a phone call. I can't remember now. Anyway, I was on a phone call this week because I've been on so many of them. And they talked about what are going to be the requirements. They have to bring a doctor's note in. Can they just come in and say they have an underlying health issue? Is cancer going to outweigh obesity? Is obesity going to go outweigh high blood pressure? And so on and so forth. And Becky Murray from St. Peter's Partners, thank you. They got over 40,000 patients they're going to be reaching out to, and they want to get the right guidance to the people, what they need. What we're being told is nothing's outweighing anyone. If you got obesity or cancer, it's going to be treated the same. Problem is, it causes a problem. We don't know how many vaccines we're going to get for next week to do this. We don't know how many they're going to set aside. So we usually don't find out the earliest, I think, because I'm usually up, Saturday at 1 o'clock in the morning, we get our first email from the Larry Sports to tell us that what our vaccine is going to be for the week, no later than Sunday by 1 o'clock within that 24-hour window. So, and then we got it properly planned from there. That's why our website really didn't go up till like Tuesday, because then you got to figure out how that category fits. So people are going to have to be patient. It doesn't mean because they're doing underlying health conditions, which I'm happy about and helped make happen. They might only say we only got 200 vaccines or 50 for the week, So, and that's going to be hard because how do you decide, So the pre-registration is going to help. But it looks like right now, and I know Dr. Whalen's team, Mary Beth Miller and all them, and I can't thank their epi department, everyone down in that department. I was working on guidelines, but it looks like you're just going to need to come in and be honest. And I have an issue with that because unfortunately some people won't be honest. Some people have gotten shots that shouldn't have gotten shots. Some people have lied. And again, I've said this, and speaking from my heart, what we did and more, we got to live with a year later. What we did, our actions, we have to live with. My actions for the last 11 months, I have to live with the rest of my life. And it might not bother you now, and some people it will never bother. But time from now, you're going to sit back saying, why did I not wait my turn? And why didn't I wait to go? That's why I chose early on to wait. To say, hey, look, let's get it where it's affecting the most population the most right now. And that was the seniors. 94% have died from this. And, that's the ones that should have got vaccinated first and foremost. So please be patient. Let people get there. If you're continuing to do the right thing, stay home. Let's get the shots in the people's arms that need it. But I just want to put a few statistics out there. Back on May 17th of last year, men accounted for 53% of all people dying at that time. Women accounted for 47%. Fast forward to now, men account for 45% 45.7 to be exact, of all deaths, and women account for 54.3%. So it's flipped since the springtime for whatever reason. We're also seeing the terms of infections, which I'll show you on the COVID dashboard behind me in a second. Disparity among men and women becomes more concerning when you consider the survey that shows women are more likely less to get the vaccine than men for whatever reason. One of the articles I can refer to is the National Geographic survey. Even showed women were less likely than men to get vaccinated by a difference of 19%. There's another obstacle we need to overcome to show women that the vaccine is safe and effective in order for us to, to get to the immunity. People that are pregnant, please, check with your doctors. I know we when women have come through our pod that are eligible, the doctor sits with them, talks to them, tells them it has not been studied through the trials. They don't know, and that they should confer with their own doctors if they feel safe enough to get it. I'm not saying yes, and I'm not saying no. That's between you, your doctor, and your decision with you, your husband, your spouse, or your lover, what you want to do. I don't know. I don't know enough about it, and the doctors have said the same thing at our pods, that it's totally between you and your doctor. They'll give it to you if you feel safe, but it was not studied. So, again, that's something you have to work out. On the other hand, one thing that hasn't changed much through this is the number of infections among age groups. People in their 20s, which I identified early on, continue to have by far the highest number of positives. Now is well over 4,000 people. But more recently, another age group has had a larger increase, the number of positives, for some examples, since January 19th of this year. People in their 20s account for 19.3% of increase. People in the age group 10 through 19 years old have increased 21%. People in their 40s, 22.4%, and those in their 30s, 22.6%. So I'm going to go to the smartboard, which I normally would put my mask on, but Dr. Whalen's not here, so I will go up by myself. So if you look at our dashboard and you're going forward, it shows you, where we were going into May, and it started to climb back up, and now we're going down into the other direction. The same thing here, if you go back before May, we're going up, you go down, and then how we had the huge spike, and now we're starting to come back down, which is all good. That means people are doing the right thing, and we're starting to get through this. The age groups is what I continue to talk about. You can either look at the 0 through 9, that age group is going up, the 10 through the 19, and then you can just see the 20 to 29-year-olds are the ones that I've been talking about since the beginning. I started watching that since day one, steadily take over, because you got to remember the 30 to 39-year-olds was the bigger category. Now look at the difference between the two. It's just the 20 to 29-year-olds have just taken off for some reason. And then you're starting to see where the 30, 39s, but you're seeing the 50 to 59 steadily start coming up too. For whatever reason, and which is alarming. But if you look at the chart also, and that's why I was hoping Dr. Whalen was going to be here to get into this side of it, but 52% female, 46% male that have total positive COVID-19 cases, and it breaks it down into different groups. And the other thing that we've been watching too is the Asian population. For some reason, we're seeing more numbers of people in ICU, and unfortunately more people in their 50s in that category that's passing away from this. And again, it's no rhyme or reason. We just try to figure it out, and males and females. But again, there was 456,000 people. That means people who got different tests throughout the time, and I think Albany counts. It was a great question that people keep inquiring. The best I can tell you is this, is that a lot of people have got tested, and the drive-through probably counts for us, and that's why you see 456,000, because our population basically is between 310,000, 320 in Albany County. I'm hoping for 320 at the end of the census, again, yeah, so that would mean everyone in Albany County got tested, but that's not factual. It's just the people that are in healthcare and other things. So I just want to remind people we can't. It's not time to get lazy. It's not time to get COVID-19 fatigue. I can assure you, after 11 months, we're all tired. I'm tired. I know Dr. Whalen's tired. It's hard because it's changed. And if you think what we were dealing with in the beginning, they talked about no mask. Mask wasn't even mentioned. Then they say wear a mask. And if I forgot, because I was talking to somebody, I'm like, because you think about the stuff we put out in the beginning, CDC put out, and as you learned, as it evolved, and as we got smarter with it, we stopped using grocery bags because they said you could carry the infection, so we went back to paper bags in supermarkets. You had to wipe down surfaces because you could get it off the surface, and that's all changed over time. And again, as you see, as we learn and science has gone through the data, and as they go science, not people's opinion, science goes through the data, and the health experts continue to watch us or this evolves, things have changed. And it's kind of funny, the things we were dealing, not funny, but the things we were dealing with in the beginning and how it's really changed over time, and some of the things we thought you had to do, you don't have to do. We talked about Merc 13, air handlers, filters, and you got to change all that out. And, it's just a variety of things. So it's like, hey, look, stay patient. We're going to get through this, but we have to stay strong. And the only way we're going to get through this is if people continue to do the right thing. I sure as heck don't want to go back, and I know no one wants to shut down again. They keep talking about March. I'm not even going to go into that. Let's just stay positive and stay, positive with the message. But educate yourself. This keeps morphing and changing, and we need just to be ready, and we need to understand this. We've come a long way in 11 months. We really have, and we had to reimagine everything. And to the people that are struggling, my heart bleeds for you, and I know it's tough. But we're going to get through it, and we'll continue to get through it, but we have to stay strong. So I do want to say thank you to all the volunteers who make the medical corps up at the Times Union Center. It's an impressive operation. I'd say the media should come down to one of the events and check it out. It's run smooth. People are in and out within usually a half hour, which is amazing, to the whole team. And it's a lot of volunteers, too, that the runners, the people on the floor, the behind the staff, it takes a lot to set it up when you're doing almost 1,600 vaccines in one night, in one day, I should say. I think they open from 1 to 7. But it's a lot of logistics, and I do want to thank the Department of Health and all the volunteers that make this possible, so thank you. I also want to commend Dr. Whalen for receiving the 4 Chaplains Award. It's a military award, about 4 chaplains that went down with the ship, and it's that gave up their life jackets on a sinking ship to save other people's lives. So it was an honor for her. It was an honor for me because I go to this every year as a military person, and I got to do a little video for her, to her and Mary Beth Miller at Department of Health, and all the people at the Department of Health, and all the healthcare workers, because this was about all the healthcare workers that are on the front line dealing with this. Thank you to the essential frontline workers, especially in our nursing homes and our ERs and our hospitals. So thank you, and to Dr. Whalen and her department, thank you for your professionalism and service to the county. But I do want to say thank you to all of them. So I want to tell people, we encourage you to continue to get tested, whether you have symptoms or not. That helps us, to know where it's at for epi, for mapping and tracing. Let's not forget about that. I think we all learned about that early on in the beginning of this. So Whitney Young, as always, great partner. You can call them always at 518-465-4771. We cover the cost if you don't have insurance. And then the University of Albany is free. The Governor Cuomo set that up throughout the state. You don't need health. Even if you have health care, you don't have to pay. 188-364-3065. Always albanycounty.com to see if you're eligible, what you're looking for, and times to wait to get tested. Our mental health, Dr. G was on yesterday, and please, anyone that needs it, call. I know it's a different world, and don't be ashamed to call and just ask a stupid question. It's all right. You know what a stupid question is? One not asked. Seriously. So, it could be something that just bothers you. That's all right. Someone will be there to help you. Please call the number to 518-269-6634. You think I know these numbers by heart by now. And our 24-hour sexual assault hotline to that team for all the work that you do. Thank you. 518-447-7716, our 211, and the New York State hotline number, as always. And we'll get through this, working together.